Good afternoon. Today I'm going to talk to you a little bit about HR 4527 S2552, which is the bill to amend the title Social Security Act to provide an option for our first responders from ages 50 to 64 who are separated from service due to retirement or disability to buy into Medicare. Due to dangerous and demanding nature of the profession, first responders often retire well before they are eligible for Medicare at the age of 65. The legislation would ease the transition from work to retirement for thousands of first responders and ensure that hardworking men and women that protect our communities have continuous access to affordable health care coverage. Currently, the current practice is if an employee of any kind of first responder, which is police, firefighter, or EMS, wants to retire early, they would have to pay to get health coverage or Medicaid until they hit that 65 years old. It's wrong because it fails to give our first responders the coverage they need, and they are forced to retire early due to being injured on the job, illnesses, and that makes them have to pay sky-high premiums with limited retirement benefits. Right now, what we're trying to do is make it so that they would get benefits as soon as they need to at the age of 50 until 64, and then they can jump onto Medicaid. What were the catalysts that led to the legislation being proposed? Many of the first responders were not able to provide or protect themselves with proper health care benefits. For example, some of the 9/11 first responders who had to retire due to illnesses or health concerns could not pay for cancer treatments or other illnesses. And this isn't just for 9/11 responders, this is for other responders. So I think it is something that is adding on to additional lawsuits that have been happening. And it's something that we should be doing to help our first responders who cannot work due to being injured on the job. If legislation fails, it benefits no one. The city-state employees will see that they are not protected by the city and state that they vow to protect. They would benefit from loss of employment or able to even keep their employees. It would not benefit the city or state from having to pay earlier coverage. If it would benefit anybody, it would benefit all first responders. The EMS, police, firefighters would feel like they could retire early if they weren't able to work or if they were sick, and they felt like the people that they helped support had their back now. Some of the key figures in this legislation that's being proposed was Representative Tom Malowski from the U.S. Representatives New Jersey's 7th Congressional District, Harley Ruda from California's 48th District, and Senator Sherrod Brown from Ohio. This is also backed by multiple police, firefighter, EMS management or associations. Also, it's backed by the House of Ways and Means and the House of Energy and Commerce. So there's a lot of backing between this bill wanting to get enacted. The name of the proposed legislation would be HR 4527, which was Expanding Healthcare Options for Early Retirees Act. It should be implemented nationwide, not only for the certain states, so that all previously retired employees who retired can get medical coverage if they just come up with medical evidence or proof that they had to retire because of injury or illness. Some cases that are similar that helped bring this aboard. So the legislators brought this up because of many cases that are like the 9/11 bills being passed for coverage. The 9/11 police officers, firefighters, EMS workers all had to retire early. Not all of them, but the majority retired early due to illnesses or work-related factors. Many representatives have sued the state and federal government due to lack of coverage and needing coverage due to having to retire early. How our HR professionals or firms or employees must change the practice to comply with the new law. Well, if it gets approved, state and local government benefits teams must comply to allow all first responders to retire early, which means they'd have to cover and expand their coverage of benefits. This would adjust the retirement age by almost 15 years, which would be expensive on the books, but would help support the ones who supported us. The law would impact the average legislation and by not they would now have to brace for other acts that would be similar to these bills, like the Zadroga Act, which was passed and then still being fought over. It's an expensive door that is opening, but in my opinion, an important one to make sure that these people who helped everybody have coverage. I fully support this bill. I think bills being introduced like the Zadroga Act will help support this one and help support our hardworking first responders that have coverage and medical attention that they deserve. Thank you.